You know, what is better than to get some real case experience, clinical case experience? Because we can talk about all the science and everything, and that's okay. But we are really caring about our patients ourselves, so we want to know if it really works. And Jen is going to show us that it does really work, and I'm really happy that you're here.
Thank you.
You told me some personal things too. Okay, where should I start? Are you getting worried?
Not really.
Exactly. So no, she's married to a veterinarian too, correct?
I am.
Okay,
yes.
And you like running?
I do.
See, I'm a magician. See, I know all these things. It comes out. And the last thing is, the way you can really make a rock is by...
Okay,
I'm sending it to you.
No.
I'm sending it to you.
I don't remember saying that to you. So.
Yes.
Well, I do try.
What's the thing that you really like?
Oh, I'm a foodie.
Excellent. Jen Fletcher.
All right. Yeah, I am married to a veterinarian. You know him as Evil Justin. He's the leaderboard. So I think he's more well known at this conference than all the other speakers here. So I'm a part of a 5-doctor practice in Harrisburg, Pennsylvania. I'm an associate veterinarian there, and this past winter we had the privilege of getting a sneak peek at the metabolic plus urinary diet and being able to have 5 of our patients participate with that diet to see how it works in the real world. I'm not going to summarize feline lower urinary tract disease anymore. I think Dr. Little did a great job of doing that this morning. And the fact that our obese or overweight patients are severely overrepresented in these patients. What I can't overstate is how frustrating this disease is for the owners, for the cats as well. They're painful, and they're constantly having flare-ups with this disease. What I also can't overstate is how frustrating this is as a veterinarian. I haven't been doing this very long, but honestly, blocked cat season happens twice a year, spring and fall, at least in Pennsylvania. And I loathe that time of year just because it's hard to get these cats treated. It's hard to treat both diseases at once, and until now we haven't been able to treat both diseases at once very effectively. So my first polling question for you two guys is, I swear this was not planned with Heather and I. Completely done independently. But in practice, what disease do you typically treat first? Not a trick question. All right. It changed. I didn't give you 3 answers. I didn't say depends on the case. So it's a pretty good majority there. 98% treat the feline lower urinary tract disease first. I'm with you on that. This is the time-limiting disease, especially if you have that urethral obstruction male cat. That's the life-threatening one. So I tend to go for the lower urinary tract disease first. Now that we have metabolic plus urinary, we have the ability to treat both diseases at once. The question is, how effective is that in the real world? So that's what we set out to do. We did an in-clinic feeding experience over the course of 3 months this past winter. From here on, I'm probably going to call it a food trial. I love the in-clinic feeding experience term, but it's really big mouthful. So I'm going to call it food trial from now on. I'm sorry, Hills. The criteria we had was cats had to be older than 1 year of age, currently showing signs of feline lower urinary tract disease. They had to have a body condition score of greater than 3 or 5 or greater, or a body fat index based on the Hills Healthy Weight Protocol of 26% or greater. And they had to have no current infection or on any current medication. They also could have been diagnosed recently with a struvite urolith. So we had that as an inclusion criteria as well. We had a total of 5 patients, 4 were neutered males, 1 was spayed female, and 2 cats were diagnosed with urolithiasis. We did not know the stone type at the time of the diagnosis, and 2 cats were obstructed upon presentation, but they did not have any uroliths diagnosed. And one cat did not have obstruction and did not have urolithiasis, so we deemed him as an idiopathic cystitis cat. So we wanted to see, if we put the owner in the driver's seat, what was going to happen at home, with strict guidance, of course. These owners were given rules to make sure that they did follow the diet pretty strictly. Our first patient should look familiar to you. You just saw him on the video. This is Shadow. Shadow is our 3-year-old male-neutered domestic short-haired cat. He was 13 pounds at presentation with the Hills Healthy Weight Protocol parameters. We did the measurements. He had a body fat index of 35%. He presented as that typical urethral obstruction cat. So the owners actually were not familiar with this condition in male cats, so they brought him in for vomiting. And then obviously our physical exam gave us the answer as to why he was vomiting. Before we anesthetized him for the urethral catheterization, we did some pre-anesthetic blood work, and typical to many of these cats, mildly hyperglycemic due to some stress, and moderately azotemic due to the postrenal causes. Otherwise, Shadow was a relatively healthy cat. We do take abdominal radiographs before we do urethral catheterization to look for any uroliths or any urethral stones as well, to see if that was going to complicate the catheterization. Other than having a very large, painful urinary bladder, he didn't appear to have any predisposition to making this a difficult procedure. And then after we do the, it's going to advance here. After we catheterize these cats, I always take a post-radiograph just to make sure I have adequate placement of the catheter. So pretty routine. His catheterization wasn't anything special. His urinalysis, we did send this out to a reference laboratory. Adequate concentration for a cat, not too high, not too low, but mostly it was red blood cells. He didn't have any signs of overt infection, crystalluria, or anything like that that was going to lead us to change our treatment plan. So he just had a bunch of bloody urine. We keep our cats in hospital with the urethral catheter in place for 48 hours where they're receiving IV fluid therapy for the azotemia. After 48 hours, we check their blood work. We pull the catheter if we're in the clear as far as the azotemia goes, and then we monitor for urination on their own. And if they urinate in the hospital, then they get to go home. So Shadow did quite well with us. His azotemia resolved. We discharged him on prazosin, antispasmodic medication, and some buprenorphine for the pain. He went down, home, and about 10 days later, he represented to us. The owners were noticing he had small amounts of urine in the litter box. He was really struggling to urinate as well. Luckily, they brought him in. He was not obstructed a second time, so he dodged a bullet, and we were able to just treat him medically as an outpatient, and he went home. At that time, we offered the owner for him to join the in-clinic feeding experience. He was actually the first patient we had to put on the food, and the owner, as you saw in the video, was pretty excited, so we could try to get his weight down. So as a summary of Shadow's food trial, like I said, he started at a body fat index of 35%. At the time of us starting his food, he was 12.5 pounds. So he was 13 at presentation, 12.5 at the start of the food trial. We did measure by cups. Sorry, we do measure that way. So he was fed 5/8 of a cup, and the owner was sent home with a cup that had that measurement specifically on that. They were asked not to feed anything else. If they wanted to combine any sort of canned with that, we offered that, but for the most part, he was a dry food eater, and he transitioned quite well. We measured his weight every 2 weeks for a total of 3 months. The owner, this owner was great about bringing him in. He was also measured as far as the same scale and the same technician every single time. So we try to keep as much consistent as possible. Over the course of the 3 months, he lost 12.6% of his total body weight. This is based off of the 12.5 pounds down to 10.9. So if you do the final calculation, it's 11.6% if you go off of 11.05 pounds. But so he lost about 11.6 to 12.6% of his body weight, and he did go down to at least 10.9. His goal weight was 10.5. So we got pretty close to that number of ideal body weight within just 3 months. And he's currently not showing any clinical signs. It's just his weight over the course of 3 months. Jules, she is our 8-year-old female spayed domestic short-hair cat. She presented after a year of being at another veterinarian for hematuria and stranguria, had been treated with antibiotics but nothing else done. She was no stranger to a food bowl, so she was a quite little portly little cat. That's her in the picture there. But other than some dental disease, she was deemed very healthy. So the next diagnostic set for Jules, if she presented to you at your hospital, what would you do? I didn't even have urinalysis, so. Excellent. In respect for time, I'm going to kind of cut it off there. Urinalysis and radiographs, I think, are the 2 basic tests to start with. So that's what we did for Jules. Here's her urinalysis, mostly red blood cells. She did have some white blood cells. No bacteria were seen, no crystals were seen. The ketones and glucose, I think, are just a cross-reactivity on the strip from the amount of blood that she had in her urine. So we started there. The same day, we also performed abdominal radiographs. And lo and behold, there's our little friend, the urolith, sitting in there, irritating that bladder, causing all this trouble. So we did not know the type of stone at the time of this diagnosis. We did offer the owner surgical and medical options. Surgical were not an option to this owner. She had some financial concerns. So we entered her into the food trial. The owner was pretty excited about this. We started her body fat index was 41.4%. She was a very petite little cat, 11.5 pounds of goal weight and 8.5 pounds, and she fed a half a cup per day. We checked her radiographs every 4 weeks and her weight every 2 weeks, so we did have to monitor this stone. At 4 weeks, Jules' stone, subjectively, it's kind of hard to see on the screen here, looks a little less radiodense. That's a subjective statement. Objectively, that stone went from 1.25 centimeters down to 1 centimeter. So we were making some progress, but it was still there at 4 weeks. And Jules, unfortunately, was still showing clinical signs. And this is what concerned the owner. This became a sticky kind of situation. The owner's family was actually pressuring her to euthanize Jules at this point because they felt she was suffering. And so the owner and I had a really good talk about giving me 4 more weeks with this diet. Just give me 4 more weeks to see if this goes away. If not, I will take your cat to surgery. We'll make this problem go away. So she agreed. She did not want to euthanize her, but she just felt like there was no other option. The cat was painful. So at 8 weeks, we took this x-ray, and it was gone. Thank goodness. The stone was gone at 8 weeks, and we were really, really pleased to see this. Not only that, Jules had continued to lose weight. She was getting close to her ideal body weight. She was down to 9.8 pounds. The owner was ecstatic, and Jules at home became a kitten again. They said she was playing, she was running around the house. She had become the cat that she had used to be. This owner hadn't seen her act that way in a very long time. The end of her food trial was successful as well. She was 14.7% body weight loss over the course of 3 months. She is also currently free of any signs of lower urinary tract disease, and we did see that stone go away by 8 weeks. And there's her little slow progression over the 3 months with her weight loss. For the entire food trial, for all of our 5 patients, all of them did lose weight. I don't have all the data here for you, but they did lose weight. True to compliance problems, we did lose 1 patient to follow up. That cat was 18.5 pounds. He was going to be my shining case. He was down to 16.8 within the first month, and then he stopped coming. So we transitioned him to, he was an obstructed cat. We transitioned him to CD multi-care, and he's been free of clinical signs since then. Another patient, he was still, the owner had some weird traveling things, so she was gone most of the week. So we deemed him a little bit more of a stress case. He was losing weight, but he was still showing some urinary signs, I think because he just missed his owner. We transitioned him to CD urinary stress, and he's been currently free of clinical signs. So we did lose 2 for those reasons. We had 2 patients with urolithiasis. Both of them dissolved by 8 weeks. It was actually the exact same day. We took the x-rays. And overall, our owners were really pleased to be a part of this food trial with us and to be kind of part of the bigger picture as far as nutrition in cats. The last thing I have is to discuss is just what do you guys think is the biggest roadblock for you as far as introducing nutrition as therapy in your feline patients? There's no wrong answer to this question. It's kind of split. All right. So it's kind of across the board with multi-cat households kind of winning out just by an edge. I'd agree with that. That's probably my biggest roadblock. Some things we learned from doing this food trial with our clients as far as my cat won't eat it. That's probably the biggest excuse I get. Well, my cat's not going to eat that. Mixing cat foods we find is very unsuccessful. So mixing a food to transition a cat, cats don't like the decision made for them. So we have owners offer 2 bowls, increasing the amount of the new food and decreasing the amount of the old food. Cats will sometimes, but most of the time, naturally go to the bowl that's more full. So the method of transition was very successful in our study here for cats. All of our cats transitioned quite well. Cost-benefit analysis. Put money where your mouth is and put this out there. With the cost of medications, the cost of exams, in comparisons to feeding your cat one food, and include the cost of their old food as well, and show the cost-benefit that feeding one food to treat this cat is going to outweigh the cost of having to see me more often in an exam and also pay for medications or blood work monitoring. Increasing the human-animal bond. With this, I tell owners it's as easy as feeding your cat. So you can feed them to treat them. You don't have to continuously medicate them. And Yola is ending right there. 2 quick things. Keep it as a treatment option. You talk about this as well as you talk about any other medication that you have on your shelf. This is a prescription, as Dr. Downing, I think it was the one who coined that term. Multi-cat households, this is the biggest roadblock I have. Trying to convince an owner to feed it to every single one of their cats, or as Dr. Little said, trying to change the way they feed their cats so they can feed them separately. Give the owners the options, but this diet can be fed to all cats in a household. So.
All right, thank you so much. All right.